Today we are taking a holistic view on public health. As we navigate a world with ever-evolving challenges, understanding the multifaceted nature of public health is more crucial than ever. This is the question which we are going to discuss today in our episode. Joining us today for this particular episode in conversation is a renowned public health advocate. He is trained as a cardiologist and epidemiologist. He is also the head of cardiology at AIIMS Delhi. Before founding the Public Health Foundation of India, he has also served as the first Bernard Lawn visiting professor of global cardiovascular health at Harvard and currently holds professorships at several prestigious universities. Ladies and gentlemen, please welcome today Dr. K. Srinath Reddy in conversation with Mr. Kapil Gupta, founder of Solh Wellness.
Thank you so much, Dr. Reddy, for being on Soul Talk Season 2. It's a pleasure to have one of the icons of mental wellness in India on this program.
I'm quite pleased to be interacting with you and through you with many other people in India.
Absolutely. We hope so too. I will straight away jump into my first question. So your book, Pulse to Planet, emphasizes the role of public health policy. In a similar context, what policy changes can create an environment that supports holistic well-being practices in India?
In fact, if you look at my book, I talk about not just public health in terms of a discipline to be practiced for the health system. I talk about the multiple connections that exist within the human body and the connections that the human body itself has to all of its surroundings and the various determinants of health, which are social, economic, commercial, environmental, cultural, and all of these cumulatively influence the health of the person. And that's the health of an individual. But the relationships between individuals also affect the health of each individual. So we are all interconnected. We are interconnected within our bodies, interconnected to our environment, and interconnected amongst ourselves. And yet, not recognizing these connections, we tend to destroy our health, both physical and mental, by disturbing those connections or ignoring those connections. And we play havoc with our body and its regulatory systems. We play havoc with the environment, which is nurturing us. And my plea in the book is that nature has actually perfected an excellent human body. In fact, if you ask me who is the greatest scientist of all, I'm not going to name Newton or Einstein or Marie Curie. I'm going to say nature is the greatest scientist of all, because through endless experiments, it has perfected what is required for our human body. And through the crucible of evolution, it has found out what the right checks and balances are and how we can actually exist in harmony with our environment. But we have actually ignored all that, and we have started flouting those lessons and disturbing our physical and mental health. And therefore, my plea is that we should actually recognize these connections. My other plea is we are actually compromising the future of the next generation by our thoughtless acts. And therefore, it's important for us to now start taking measures so that we can protect the environment and protect other elements also which support health, whether it is agriculture and food systems, or whether it is urban planning and transport and the levels of pollution that are created. All of these we must actually look at so that not only our generation continues to be protected for the years that we have left, but much more importantly, the future generations will not suffer because of the problems that we are leaving for them.
Sure. Thank you for that. So the concept of planetary well-being that you talked about right now also is central to the book. Can you envision a future where human health and environment are in sort of perfect harmony? If so, how can we achieve that outcome?
Firstly, I think it's absolutely important for us to recognize that our climate is configured by a number of factors, and we must ensure that the climate is supportive of our health. And the planet itself should be able to survive, not just in terms of physical survival of some meteor coming and hitting it, but even its own ecosystem must survive. There is something called the Planetary Overshoot Day, which means that the planet has a capacity to regenerate its natural resources every year. But if we overspend, we overdraw, then there is a deficit budget for the nature in terms of what it can regenerate.
Mhm.
And that deficit is filled by consuming already existing resources and releasing carbon dioxide into the atmosphere, which means that we will be living on a deficit budget and creating problems. Interestingly, in 1970, the Planetary Overshoot Day was December 30th. That means only one day we were in deficit.
Okay.
The rest of the natural resources were regenerated.
Mhm.
Last year, in 2023, the Planetary Overshoot Day was the 2nd of August.
Wow.
And if the whole world had lived like Qatar, the Planetary Overshoot Day would have been February 14th.
Mhm.
If the whole world had lived like Luxembourg, the Planetary Overshoot Day would have been February 10th. Each year, the Planetary Overshoot Day is receding. That means our ability to regenerate our natural resources is shrinking. So we are running nature on a deficit budget. So
Mhm.
that is where we must recognize that whether it is air pollution, whether it is climate change because of carbon dioxide accumulation and greenhouse gases, including methane, or extractive resources being drawn, extensive mining, pollution of the oceans, all of these are upsetting the natural balance. And our health is determined by that and dependent on that harmony. The body itself has something called homeostasis, which every medical student is taught about, that the body has so many mechanisms and systems within it, whether it is the hormones or the nervous system or the muscles and the skeleton, they all learn to work in harmony with each other so that our body can function well. That's called homeostasis. And you
Mhm.
keep a certain level of stability. But there is also allostasis. That means when you have to react with your external environment, then you still have to maintain that balance and stability, irrespective of changes in that external environment. Now, we have destroyed our homeostasis and we are unable to retain allostasis. That means whether it's ultra processed foods that we are consuming, whether it's tobacco that we are consuming, whether it's polluted air that we are breathing, or whether it is the extreme heat of climate change, all of these are not only upsetting our internal systems, but they're upsetting our ability to react to external challenges. And that is where, when you ask how can we live in harmony, we have to recognize all these influences and make sure that they work to our advantage and not that we actually turn them against us.
Okay. So let's talk about the work that Public Health Foundation of India does, which is, key to public health. Um, how can PHFI contribute to building a strong mental health care system in India, whether it is in terms of training professionals, promoting literacy, advocating for some policy? How can PHFI or how does PHFI contribute in that?
Well, for mental health, again, because mental health, like physical health, is dependent upon multiple determinants. So let's take the health system, which is only part of the response.
Mhm.
So, and when people ask me what's the difference between clinical medicine and mental health, I try to explain to them in a simple way that clinical medicine delivers health in retail, whereas public health delivers health in wholesale
Sure.
to large population groups. So both are important.
Mhm.
But what public health does is it identifies and influences all the determinants of health, particularly those are important in that specific context,
Sure.
to try and improve those determinants so that we can impact upon health of individuals.
Mhm.
So it does through public policy, it does through systems, it does through health programs, it does through community engagement.
Mhm.
So what we are doing is essentially trying to ask for strong health systems,
Sure.
but also supportive social systems. Now, specifically, mental health is something that should be dealt with best by way of prevention, but even by early detection and care at the community level.
Mhm.
Don't want institutional care. That era of mental hospitals is gone,
Sure.
practically. What you want to do is to prevent problems, otherwise identify problems at the earliest and try and manage them so that mental health is improved. So
Absolutely.
you must bring in mental health into primary care. Strengthening rural and urban primary care is most important. And it's also important that we do not depend only on doctors. Doctors are in short supply, but even otherwise, they do not really always have the time to provide the kind of care required. We don't
Sure.
have enough number of trained psychiatrists and others. But apart from psychiatrists and the clinical psychologists, a lot of work in mental health can be done by non-physician healthcare providers, that is frontline health workers. Even the ashas, the auxiliary nurse midwives, the Anganwadi workers, all of them can actually be very important resources for mental health. Some of the studies done abroad have shown that if you have lady health visitors, like in Pakistan, they were looking after obstetric care, pregnancy.
Mhm.
But it so happened, it was shown that peripartum depression also was greatly decreased because they also provided mental health support.
Absolutely.
That was not part of the program, but that was a benefit,
That's a beneficial side effect of it.
side
Sure.
effect, what we call a positive externality or whatever, but
Mhm.
essentially a very welcome benefit.
Yep.
Right? So we need to do that. Plus, we need to bring in community resources, family resources into play when we are short of mental health, where professional expertise is required, where you require a trained psychoanalyst or a counselor or a psychiatrist, then certainly you ought to take that into account and build those facilities as well. But majority of the things can be handled otherwise. Same thing with schools. If you have trained teachers, apart from a school health clinic, a good deal of mental health problems in the schools can be taken care of. Schools
Mhm.
and colleges should also have peer-to-peer counseling groups. You can actually, there's no reason why college students cannot support other college students and school students can't support other school students.
Mhm.
So we ought to really broad base our ability to provide mental health support services. Then, of course, at district hospitals and medical college hospitals also, we ought to bring in all of this. But very importantly, I think we should let people become more aware that a lot of this can be prevented. Some of it, which has occurred, can be recognized early and care should be sought. Destigmatization is absolutely important. Previously, anybody with a mental health problem, the family never reported it. They hid it because they were afraid of the stigma attached.
Mhm.
And they never sought care or provided continuity of care. So we need to destigmatize it. Recognize that much of this is very much eminently treatable, reversible, and certainly by stigmatizing a person, you're not going to help the person. So
Absolutely.
all of this is going to be brought in through public health, through policies and programs and systems, and creating a health workforce which is much more attuned to mental health issues.
Sure. So you talked about destigmatization, you talked about early detection, and you talked about prevention. Um, I guess my next question would be, what role can technology play in this?
Well, technology is playing a role. For example, we know that telemental health services are helpful. See, ultimately, a person who is having a mental health issue is looking for connection with another human being who can provide some degree of support and succor, right?
Mhm.
So that can ideally it should be person to person. But when that's not possible, even telemental health services can be very helpful. That
Sure.
somebody is listening to you, able to counsel you, is going to be very helpful.
Mhm.
And of course, there are other technologies which also help you. For example, stress. If you're, for example, having a wearable and shows that your pulse rate is racing suddenly when you're facing some challenge, you know that you're facing a stressful situation, that you have
Sure.
to do something in order to
Mhm.
reduce that level of stress.
Sure.
So, so technology can actually play that kind of a role.
Okay. Perfect. That has been the focus of what I have been doing for the last couple of years. What in a lot of ways, what we are doing is we are trying to empower people with what we call as self-help tools. So tools that people can use with technology, with a platform by themselves. Community support tools, which consists of support groups and other capabilities to get peer-to-peer or to get community involved in providing support, and of course, expert services, which could be clinical expert services working with a psychiatrist or a psychologist, or even allied therapy services, even going out to the extent of integrating homeopathy and Ayurveda and other forms of medicine, yoga and meditation and art and music and dance and other kinds of performing capabilities, and various other religious, spiritual, and other activities that people would be interested or people would be able to get mental wellness support from.
Absolutely. And the so-called non-allopathic systems or alternate systems or complementary systems, whatever we call them, are very much attuned to this.
Yep.
They are very helpful in dealing with some of the mental health issues by reducing the level of stress, getting the person to control one's own emotions much better.
Mm-hmm.
In fact, if you read the chapter on stress in my book, just to summarize it, what is stress? It has been a reaction to a perceived threat,
Mm-hmm.
not to protect yourself. Our
Sure.
hunter gatherer ancestors ran away from the beast, or while gathering food, they were wary of the beast coming in. So it was a fight or flee reaction.
Yep.
But for that, your muscles had to get tense. Your blood pressure had to rise high, and your pulse rate had to rise high because your heart had to pump more blood into those exercising muscles. Then your blood sugar had to rise high, both for the brain to make life-saving decisions and for your muscles, which are now exercising,
Mm-hmm.
fighting or fleeing. So your corticosteroids went up, your adrenaline went up, and your body would generate more heat during those situations. So you started sweating in order to get rid of the heat, and your
Mm-hmm.
pupils would get dilated because you had to sight the beast coming from either any direction. And because your blood supply had to be diverted predominantly to the brain to make life saving decisions and to the legs because you had to run,
Get to that.
uh,
Yep.
so your blood supply to your stomach and intestines was reduced. So you
Yep.
got this cramp or butterflies in the stomach. These were all protective phenomena.
Yep.
But now suddenly you bring a person into modernity in a very different situation, and that perceived threat comes when your boss shouts at you or your teacher scolds you in the classroom.
When you can't run.
You can't run away from the teacher, you can't bash up your boss, right?
Mm-hmm.
No fight or flee.
Yep.
So you internalize that stress. And that when the stress gets continually internalized and repetitively, like in modern life, then you're destroying your body's harmony, raising your blood pressure, and you're going to be destroying your blood vessels. You'll be developing diabetes. So the alternate systems of medicine tell you how to relax, whether it's
Absolutely.
yoga, meditation, and others. You could do it with music, you could do it with books, but all the alternate systems of medicine ultimately say, look, let us restore homeostasis.
Right.
So that is the most important, getting the balance back in the body.
Sure. So one of the aspects that I always find very interesting while looking at the overarching system around mental wellness is the amount of sustained investment that is there versus what would be required to ensure a comprehensive implementation, specifically in an environment like India, where we many times get very focused on curative for all the right reasons, but we have to get very focused on curative structures because there is always lack of funding, because there is always lack of resources, and because of the kind of population, the kind of poverty, and the kind of environment that we have. So what strategies do you think can be implemented to increase the investment, the workforce, or the solutions in mental wellness space to address this gap?
One is what the health system itself does. Definitely, by investing more in primary care and building in mental health programs very strongly and effectively into primary care systems, we can do a lot. Then it's not necessary that only the health system has to deal with it. For example, worksite wellness programs in factories, industries, offices, they ought to be able to attune to promoting mental health and protecting mental health. So you can actually have some of those programs internally funded. And the productivity of a workforce is going to be much better if they're mentally not disturbed, if their mental health is strong. So if you tell the industry, for example, that apart from physical measures like checking their blood pressure or diabetes and things like that, which are also often related to mental health challenges, your workforce is going to be much more productive in quantity and quality if their mental health is protected. So invest in it. Similarly, schools and educational system, invest in it. So I think it has to be multi-sectoral, multi-stakeholder. It has to become an all-of-society affair. And we have to do a lot of public education, how parents deal with children. Look at the kind of pressure cooker atmosphere they're producing by sending their children to these coaching classes in different parts of India. And those kids unable to bear the pressure are committing suicide. Similarly, a kid, even a high school student who has passed out, desperate to get into medical college because the parents want the girl to get into medical college, and if she is not able to get 90% and above in NEET, she commits suicide. So I think we'll have to train all of society, firstly, to not to create stress, then how to cope with stress, and how to help others cope with stress. So investments are necessary, but investments will have to be done at multiple levels by multiple groups of people.
Sure. So, in my view, and from the numbers and the statistics and data that is there, mental health is increasingly become a critical public health concern. And according to me, at least, public health concern number one. I mean, probably even bigger than the COVID pandemic in its shape or in its form or in the kind of impact that it is having on the society. In your view, what are the key steps that India needs to take to ensure a comprehensive and equitable mental health service, specifically looking at the next 5 to 10 years, not just talking about today, but specifically looking at the next 5 to 10 years, as the level of stress, as the level of, I don't want to use the word unhappiness, but as the level of conflicts with the environment or conflicts with the surroundings continue?
Well, as you rightly pointed out, prevention is the best thing. Second is early recognition. Third is effective treatments. Or when I say treatment, I'm not only meaning drugs, method of reducing the problem.
Absolutely.
So there, I believe it's important for us to look at what we can do across the board within the health system. But through the health system, also influence other systems, other sectors, and say, okay, what can you do to promote mental health? So I think that's going to be an important element to reduce the situations where mental health can be affected. Then there are some people who will develop serious mental health disorders. I mean, we are not only talking about stress and anxiety and other problems, but there are going to be problems like schizophrenia. There are going to be problems like autism. There are going to be problems others which are there, which are going to be problematic. I mean, bipolar disorders and so on. There, the ability of the care providers at different levels of the healthcare system to have early recognition of the problem is going to be important. Or even if, for example, there are behavioral disorders, how well are our teachers trained for it, to recognize? How well are they trained to deal with it? So those are important. So I think it has to be across the board skill building.
Mhm.
But the health system has to take the lead in first demonstrating what it is doing for people with mental health challenges, right from primary care to tertiary care,
Mhm.
but also engage with other sectors and say, this is a problem which is acquiring serious dimensions, but much of it can be prevented. A lot of it can be provided relief, but based on settings and situations, different types of interventions will be needed. So this is what you need to do in schools. This is what you need to do in colleges. This is what you need to do in industries. This is what you need to do in community groups, things like that. Those are going to be important.
So, in fact, we have created different programs that we call as a school wellness program, which is for schools, educational institute wellness program, which is for colleges, an employee wellness program, which is for corporates, and a hospital wellness program, which is actually for patients and caregivers and doctors and people that are part of the healthcare system. So one of the things that we looked upon, which I found extremely interesting, is we did a very thorough analysis of the 17 SDGs that are defined by the UN. And one aspect which really intrigued me while doing the analysis is 8 out of those 17 SDGs will not be complete without a comprehensive mental wellness intervention. Having, in fact, in my last book called as In My Head, I actually have done a detailed description of those 8 SDGs and talked about what do they mean and how do they impact and what is it that can be done. Um, and while I'm saying out of the 17 SDGs will not be complete without a comprehensive mental wellness intervention, the amount of, I'll get down to budgets and numbers because, at the end of the day, that defines the amount of activities and the amount of interest. The amount of budgets that are allocated for mental wellness vis-a-vis the amount of budgets or the conversations or the focus that we see around the concept of sustainability right now, the numbers just don't add up. Where do you think we are missing? Is it just, in its communication, or is it in its urgency, or, where is it that we are missing putting the right kind of focus on mental wellness?
See, the problem is much of the global agenda of development, including health, has been driven by high income countries. First, they came and said tropical medicine because they were colonizers and they wanted to protect their soldiers, their traders, their administrators, and also their workforce in the colonies.
Mhm.
Then later on, after decolonization, they came and said international health. We'd like to find out what are the problems that you are having and what can we do for you. And in the process, also export their own medicines and devices and things like that. So it is economically, it was a good thing that they took interest, but it was also an economic incentive for them to export a lot of their medical equipment and drugs to low and middle income countries. Now we are talking about global health. It is not that high income countries will come to us and say, what can we do for you? It's that we all sit together and say, what can we do together?
Yep.
And in that context, mental health has acquired importance. Just to give you a little background, when the WHO, the World Health Organization, and the United Nations convened a UN high level meeting in 2010, 2011 in New York, on non-communicable diseases. Only 4 diseases: heart diseases, diabetes, cancer, and chronic respiratory disease were included. Mental health was not included.
Mhm.
India at that time, the Indian government delegation at that time said mental health has to be included. So while it was not part of the identified risk factors and illnesses, mental health was mentioned in the final political declaration. And by 2015, in the SDGs, it was included.
Mhm.
There has been a greater global recognition that something has to be done about this. This is an increasing problem. And I think we are now going to see a lot more interest in the mental health area because of the drug addiction problems that people are having. Western countries are now appointing ministers for loneliness. Whoever heard of that before?
Yep.
So there is a lot more interest in mental health now, apart from physical health. And anyway, they both are interrelated.
Mhm.
So, but it has taken time. It has taken time. And the problem of medicine has been mostly to try and look at problems as individual problems, not problems which are created by society and systems.
Mhm.
So if you look at mental health, it's seen as it is that person's problem, not a group or a community's problem.
Mhm.
Whereas an infectious disease is seen as a community's problem. Oh, it can spread from A to B and B to C. So we must do something about it.
Mhm.
But what we must recognize is, firstly, apart from the fact that we are all empathetic human beings who should be worried if somebody else is mentally unwell, stress, mental illness, and tensions in society can create problems for everybody else. Why is it that people are walking into schools and shooting up people in America? Why is it they're walking into malls and shooting up people in America? It's because the mental stability of people has been disturbed. Apart from the fact that they have a fetish for guns, they have a problem with their mental health.
Absolutely.
So this is, or if somebody goes around knifing little kids in school. So that those are extreme forms. What we see that every day in the streets of Delhi, road rage, people getting out of cars and beating up each other because or bumping their car into somebody else's car because of road rage.
Yep.
So we ought to really recognize that mental health is a serious challenge to a very large number of people and is a part of our everyday occurrence. And then our systems will be much more geared to deal with it.
In fact, one of the notions that I regularly deal with, so I do a lot of mental wellness related workshops in schools and colleges and corporates. And one of the notions that I always deal with is, in my view, mental wellness is as communicable as anything else in the world. I mean, people
Of
talk
course.
about it as a non-infectious, but put one stressed person in a room full of, people, and just somebody with high level of stress, and suddenly in a matter of fractions of seconds, the entire room will become stressful. I mean, it's in my view, it is extremely contagious. You can't live around people. But I'm not even talking about disorders from a mental wellness perspective, but basic aspects of somebody with anxiety will drive the entire room crazy and increase the anxiety level in the entire room. Somebody with any sort of mental health challenge, I mean, it becomes extremely contagious and
Yeah.
infectious. Just that it is not reflected, or it is not communicated through a virus or a bacteria, or or a pathogen, is why we classify it as an incommunicable disease.
Yeah, I mean, you can completely upset the balance of a group. You can balance in your house. You can, I mean, the entire atmosphere can change, and other people's health and can be affected. Their blood pressure can rise. In
Absolutely.
fact, if you read my book and the story of stress, I also talk about John Hunter. John Hunter was a very famous professor of anatomy. But those days, anatomists also used to be involved in surgery and things like that in the UK, in Britain. So uh, John Hunter said he described what happened to him. He had angina, and which is chest pain because of coronary blocks. He did not know exactly what was happening in his coronaries, of course, in those days, some centuries ago.
Mhm.
But he said, "My life is forfeit to any rascal who chooses to annoy me." And as he predicted, in a stormy meeting in which they were discussing medical college admissions, where there was a heated argument, he collapsed and died. He had a sudden cardiac death. So you can actually not only harm yourself, you can kill somebody else
Yep.
through a mental health issue, problem.
Ab- Absolutely. So, Dr. Reddy, I mean, thank you so much for your insights, your wisdom, and sharing your thoughts with people here. Is there any last thoughts, comments that you would like to leave the audience with?
I think one of the things that has happened is that we are now living in a society which is full of conflicts within human beings and between human beings and
Mhm.
between countries. We are seeing that every day,
Absolutely.
and our political discourse has become very violent and vitiated. Armed conflicts are raging across the world. And even when survival is required, like a response to climate change, we are still arguing and debating about what to do. I think it is absolutely important for us to restore mental health to a certain level of balance so that our health can be in harmony. And since our physical health, which we prize so much, we worry whether we've got diabetes or whether we've got high blood pressure or something like that. All of them are also dependent on mental health.
Absolutely.
Stress precipitates diabetes. There is something called stress diabetes.
Mhm.
And similarly, stress can precipitate and perpetuate high blood pressure. So we must recognize these connections and say, okay, let's maintain our mental health with as much commitment as we pursue our physical health.
Mhm.
They
Ab-
cannot be separated. And
Absolutely.
they cannot be entirely left to an individual. None of us are yogis living in the Himalayas. And even yogis living in Himalayas will have to depend upon some devotees to come and give them food. So everybody is dependent on somebody else. So, as a collective society, let us preserve conditions which are supportive of mental health for ourselves and for others. I think that is the most important message that the world should get.
Absolutely. So, thank you so much for that. In fact, one of the things that we did when we were creating Soul, and actually I also talked about in my book, is we classified the reasons for mental health into what we call as the four C's. And you almost took the words out of out of that. So we talked about climate, we talked about conflict, we talked about contagion, and we talked about conformity. And you talked about all those four in this. So absolutely agree. I think there is a lot that needs to be done. It's something which needs to become a key focus area. A lot more investment needs to be done, and more than that, a lot of from my perspective, in the work that I'm doing, I think there is a lot of innovation that is required in mental wellness. Like you talked about the community outreach, or the capability for the community to intervene. I would take that further and say mental wellness needs to be handled through a tech driven, AI enabled, scalable solution that can reach everybody. So today's mental wellness becomes very much disorder centric because we have limited amount of resources, because we have limited amount of capability to reach out to a psychiatrist or a psychologist or a counselor or anybody. To scale this up, to provide everybody and anybody capability, it need to take the form of technology in a scalable manner, and then we can probably be in a better shape.
Sure, wherever technologies are helpful, we should take the best advantage of it. But
Absolutely.
wherever technologies are becoming abusive, like sometimes social media we should be able to control that as well.
Oh,
So I think it's absolutely important that we make the best use of technology.
I could not agree more.
And then you mentioned a lot of C's. So let me add 2 more C's. Since we have a consensus on this, we need concerted action with commitment.
Concerted action with commitment. Absolutely. I mean, for the 4 C's, consensus, committed action, and concerted effort. That's, I would definitely add that to the list of solutions.
Right.
So thank you so much for that, Dr. Reddy.
Okay, bye then. Thanks.